Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. I'm Yasmin, the Member Engagement and Communications Manager at GIG Gulf Insurance. Our episode today is super important for all the gentlemen listening to us. We'll be discussing the types of cancer common among men, such as prostate and colorectal cancer. Though cancer is scary, it's comforting to know that if detected early, it can have a high survival rate. We're here today with Dr. Saeed Rafii from Mediclinic Dubai, a UK-trained and board-certified consultant medical oncologist with over 20 years of experience. He has an extensive expertise in clinical trials and has been chief, principal, or co-investigator on over 100 early and late-phase oncology clinical trials. Dr. Rafii also holds a PhD and a postdoctoral fellowship in molecular cancer genetics. Welcome to our podcast, Dr.
Thank you very
Saeed.
much. Thank you for having me, and good time to all of our listeners on this podcast. Thank you.
Thank you so much. So I know it's kind of common knowledge, but if you can just tell us what is cancer or what is a tumor, and if there's a difference between them.
Yes, of course. So basically, tumor is a part of your body that is growing a little bit kind of faster than the other side. You know, anything that forms a lump or bump in your body can be defined as a tumor, but not all the tumors, they are cancerous. They do not have the malignant potential. Some of them, they are benign, and they do not get really to the stage that cause problem. So anything that is defined as cancer is a lump which is invasive into the stroma, which is bearing the kind of blood vessels and lymphatic vessels, and it has the ability to proliferate more than the other sites of the body, and also can go to other places and in the body that we can call metastases. So from the original place, which came in the breast, in the prostate, lung, etc., to go and spread to other parts of the body. So this is the difference between the cancer and a tumor. Tumor is a lump that do not have that kind of potentials, but the cancer is the lump that has the malignant potentials, basically.
Okay, what are the most common types of cancer between men?
So the worldwide, obviously, breast cancer is the most common one. Worldwide, lung cancer is the second most common type of cancer, and after that, probably colorectal cancer. In this country, in the UAE, things are a little bit different. Thankfully, we do not have that much of lung cancer in this country, but colorectal cancer remains high in incidence, and probably the most common one in men. In both sex, men and women, colorectal cancer probably is the second most common cancer in this country.
Okay, what about prostate and testicular cancer? Where do they fit in this?
The testicular cancer is probably the second most common in men. I beg your pardon, that is prostate cancer is the second most common cancer in men, whereas testicular cancer is actually fairly rare. It is not very common indeed. There is differences between prostate cancer and testicular cancer, as we discuss later.
Okay, so can you tell us the survival rate of prostate and colorectal cancer?
Look, the survival rate of all cancers, not only prostate and the colorectal cancer, it depends on when you're going to actually discover this patient. If you find the cancer at earlier stage, which is usually very small in size, it has not involved the local or regional lymph node, it has not gone to other places in the body, other tissues in the body. These are usually early stage cancer, and by far our aim in majority of early stage cancer is to cure the patient. As the cancer starts to grow bigger, the size of the tumor is larger, as it starts to actually invade other tissues such as the local lymph node or go to other places. Sadly, the aim of the treatment is no longer cure, and therefore, obviously, the survival rate of this patient, they are different from the patients that we have the kind of diagnosed at the earliest stages. So it is really very difficult indeed to pinpoint really a particular survival rate. And nonetheless, we have come to an understanding that 5 years from the time of the diagnosis is the measurement that we say that if by 5 years that patients they do not die as a result of this particular cancer, we kind of measure the survival rate along that kind of timeline. It can be variable between different type of cancer. I think what I really don't want to do is just to put my fingers on an exact number, because that could be fairly misleading. What I want our listeners to understand is that the more effort that we do, either from the population point of view or from the healthcare profession to diagnose cancers, regardless of what type of cancer it is, at the earliest stage, the more successful we are, all of us, in terms of offering cure to our patients.
I mean, I couldn't agree more. That's kind of why we're doing this episode, to just spread the awareness so that people know what to look for, what symptoms to look for, and when to seek medical advice, even if it's just for a checkup. Like, it's better to get a checkup and find out you're okay than to just wait and ignore it, and then maybe something develops. So
absolutely, and thank you very much for highlighting this.
Thank you. Okay, so can you tell us what the symptoms are, just common symptoms that men should be on the lookout for?
I presume you're talking about prostate cancer.
Yes.
So prostate cancer, generally speaking, used to be a disease of older men. You can have some urinary symptoms. The stream of the urine sometimes get a little bit tinier than it should usually be. There are some dysuria, as we call it, or kind of the passing of the urine. It hurts. Very occasionally, you might be able to detect some blood in the urine or in the sperm. So these are the kind of the symptoms. But generally speaking, to be honest, we should not leave it until we get the symptoms. This is the whole point about this, because once you start to get the symptoms, it probably tells you that it is already too late. So this is why it is important for our men, please. If you are above the age of 50, we encourage you to go and see a urologist on an annual basis. There are some screening tests can be done. They examine you. They can do ultrasound scan. There are certain blood tests that they can do. And then, we are aiming to detect those cancer before they actually reach to the stage that can cause symptoms. When it comes to the colorectal cancer, pretty much the same again. You can have some bowel symptoms, difficulty passing a stool. The caliber of a stool may be different. Your bowel habit could change. If you were very regular before, now you might have diarrhea, or you might have a constipation, abdominal pain, passing blood from the back passage, losing weight, and so on and so forth. But again, those symptoms are the ones that when you develop, then it probably tells you that the cancer is as a larger size, and then kind of more advanced stage. So we should not be leaving things at that stage. So this is why it is important that again, we go and see our doctors, colonoscopy, some fecal immunohistochemical kind of test, or fecal occult blood, in order to diagnose any cancer at an earlier stage rather than a later stage. We will come in a second to how we're going to screen these patients, but we are thankful that we have now more advanced tools in our use, so that we can offer earlier diagnosis of this cancer as well.
Okay, you mentioned that prostate cancer used to be called or categorized as the cancer of old men. Has that changed, or is that still the case?
It is more or less still the case. Having said that, in the UAE, obviously the composition of the population a little bit younger compared with the rest of the world as well. In this country, we do see prostate cancer in younger population who are not kind of that normal old age men. So we have quite a few patients that are coming below the age of 50, and they present with advanced prostate cancer, unfortunately, because, you know, obviously below the age of 50, almost nobody is aware of prostate cancer. And one of the reasons that we are having this podcast is just to highlight the importance of this for the resident of this country, please, that, you know, the incidence and, you know, the kind of the timeline that we are talking about in this country is slightly different to what we see from the literature and the rest of the world.
Okay, that's very interesting. Is colorectal cancer also considered a disease that also only affects old men?
In some part of the world, yes, of course. You know, we have more older population. In other parts of the world, the population in this country is much younger. And in this country, actually, we see a lot of patients with colorectal cancer at a young age. In fact, our colleagues have recently published data that basically it kind of give you the categorization of the different type of cancer, including colorectal cancer, in different age groups. And it is actually funny enough to, you know, I mean, it's not funny, but it's interesting to see that around nearly 50% of our patients, they are diagnosed below the age of 50. So that is definitely not what we see in the rest of the world. So this is, you know, the data that we have in this country is basically telling us that we need to highlight the importance of screening below the age of 50, whereas in other parts of the world, it may actually be different.
Okay, so is there a way to kind of reduce the risk of getting these cancers, or is it just?
Of course it is. You know, first of all, you try to reduce a risk if you know exactly how you get the cancer. Sadly, we do not know exactly why we get cancer, but we have identified some risk factors for this. You know, for instance, we know that certain type of diet, it puts you at a higher risk. Those that are, you know, red meats, a lot of blood sugar, glucose containing, carbohydrates containing, those diets that they give you central obesity, they cause a lot of inflammation around that area, and they predispose the risk of cancer. We know that certain habits, such as, you know, high consumption of alcohol, for instance, or cigarette smoking, they definitely put you at a higher risk of developing cancer. So these are the risk factors that it is within our circle of control that we can modify. So these are the modifiable risk factors that we have. There are some risk factors that we cannot modify. There are some
Genetics.
certain genes that we have been born with. You know, luckily they are not very high incidence, but we do actually have some of the populations that they are born with a gene that they cause them to get cancer. In those cases, we actually know that the individual, it is at a higher risk of developing bowel cancer, or for instance, prostate cancer, in which case we can go and do more frequent screening starting at the earlier age, because that person is carrying the gene. For the rest of the population, it is best to modify the risk factors that are modifiable, reduce carbohydrate intake, reduce the red meat, reduce alcohol intake, stop smoking, sugar, basically reduce the sugar intake as well, and obviously more healthy lifestyle and more exercise.
Okay, you discussed screening. So can you tell us what are the screening tools available, and how frequent men should be getting screened?
So obviously we have different tools for different type of cancer. So there is no one tool that is perfect to pick up all the type of cancer and exclude non-cancerous ones. So this is called sensitivity and a specificity. So a specificity is that how that test is specific to detect that type of cancer and exclude other things which are non-cancerous, and the sensitivity, how sensitive is that test to actually tell me that this is really cancer. So we have different tests, and you know they stand differently in terms of those terms. But generally speaking, a combination of different tests rather than just one single test is definitely better than we're relying on only one test. So for instance, for colon cancer, we look at the blood, we call it occult blood in the feces. We do some immunochemical tests in the feces as well, so FIT and FOB. So these are the tests that we do. Plus, when it is combined with the colonoscopy, which is the direct visualization into the colon, looking at any polyps or any abnormal growing and then taking it out. So these are really combined together. It increases the likelihood of picking cancer at the earlier stage. People are actually working to see if we can have some blood tests so that we can detect small particles of cancerous cells in the blood before it is actually visualized on the CT scan. And by large, these tests, they have given us different type of results so far. But recently, a test was approved by the FDA, and it is also available in the country as well. So putting all of these things together, the recent blood test, which is approved by the FDA, the colonoscopy, doing the fecal occult blood and FIT, you know, hopefully this should have adequate amount of sensitivity to pick up the cancer at the earlier side. Coming to the prostate cancer, things are a little bit different, really. You do need examination by hand, by a urologist, to have a look at the size and the kind of the border of the prostate to see how rough or smooth the prostate could be, whether they can detect any lump or bump or anything in the prostate. A blood test called PSA, or prostate specific antigen, and also ultrasound scan. So these are the, you know, we usually recommend every year, if you visit your urologist, to basically do those tests.
Okay, thank you for that. What about treatment options? Is it purely surgical or non-surgical?
Again, you know, it depends on the type of the cancer and the stage that we are discovering the cancer. If we are discovering, obviously, at the earlier stages of the colorectal cancer, usually surgery. And surgery is usually curative if we diagnose the patient at earlier stage. When it becomes a little bit later, meaning that the cancer has already gained access to the lymphatic system, surgery on its own may not be enough. So we may actually need to give chemotherapy after the surgery. In some part of the colorectal parts, such as lower rectum, we possibly need to also give radiotherapy. When it comes to prostate, you know, yes, if you diagnose it at the earlier stages, you can have either surgery or, you know, sometimes you can have radiotherapy, and they are usually curative. If it is a later stage, then we need to combine it with other medicine, such as some hormonal therapies, in order to reduce the risk of recurrence of the disease.
Okay, so I imagine recurrence is purely related to at what stage the cancer was caught. So if
indeed.
it was caught in early and it was done surgery, done, that's it, then the risk for recurrence is low. But if it had spread to the lymph nodes, then the risk for it spreading to other parts of the body is when it becomes higher.
And that is absolutely the case. I mean, risk is a risk. You know, when we are talking about the risk, we usually give you a percentage. And, you know, what the percentage is not your own individual risk. It belongs to a population of 100. So we have calculated the risk out of 100, or, you know, a larger population. So that is not exactly an individual risk. Nonetheless, you know, obviously the lower risk, it tells us the likelihood of recurrence of that disease is deemed to be very low, whereas it is a higher risk, it is more likely for this disease to come back.
Okay, from your experience, have you found that there are other non-medical practices that sort of support cancer treatment?
Look, you know, obviously these days we have to practice medicine, as we call it. It has to be evidence-based. So, you know, whenever we are suggesting or recommending a treatment, whether it is a medical treatment or non-medical, it has to be based on some evidence. In medicine, we produce our evidence based on clinical trials. These are usually large-scale clinical trials. Patients are followed up for a long period of time, and then we will find whether treatment A is better than treatment B, and so on and so forth. Where I'm not really aware of any very large-scale clinical trial to to suggest that one particular non-medical treatment can actually improve the likelihood. But there are something. I mean, positivity is something that we all know that it is really good to have. Inject a point of happiness into yourself all day. Just be positive about it. If you are diagnosed with the cancer, this is outside your control. You have been diagnosed with this disease, but go to it as much as difficult it can be with a positivity. Receive the treatment. Hopefully, that positivity in conjunction with the medical treatment is going to help and then offer a curative treatment for our patients.
I do believe that the status of your mental health or mental well-being can impact how successful the outcome is for treatment. So if someone is a bit more positive towards their treatment, then maybe they will have a little bit more of an improved outcome than someone who's kind of given up.
Absolutely. And, to be honest, you cannot just draw that conclusion to everybody because, obviously different patients, they're going through different the stages of the disease and, different experiences, either with the disease itself or the treatment or the combination of both. And, it is often easier said than done, but I think it is down to each individual patients to help themselves really to help with that particular situation. But generally speaking, cancer is a complex disease. It requires help from the patients, from different type of doctors, and the whole community, family support, the whole society support in order to have a treatment.
Yeah, of course. And I think this is why support groups are very important to know that someone else is going through that same experience and to kind of just support each other through it. I think it helps. I mean, I don't have an experience myself, but I do believe that just having someone with you.
We are very lucky indeed that we have support groups in this country. There are hundreds of them. I just want to highlight Latifi Foundation here, who is doing a great job. Basically, I mean, they are extremely supportive. There are support groups for different type of cancer, including now we have some men's support group at Mediclinic indeed for patients with men who are going through this cancer. Men, they traditionally they have a different type of mindset. They are more quiet. They are not more into having groups, and they don't want to openly talk about these things. And maybe we should actually use this opportunity to highlight that if you have developed a cancer, please feel free to reach out to other people. Come and ask for help. We can talk about it. There are other things that are not related to your cancer specifically, but maybe you want to talk either with your doctor or, we can have a support group. And I think, that would certainly help in terms of, just having, going through that experience to make it more comfortable.
Of course, because it doesn't just impact, it's not just like if you have cancer, it's not like, okay, I have cancer and this is it. It impacts your life, your work, your family, your kids, if you have any, your marriage. So there's just a lot of other aspects that get impacted, and it's just good to have a support group.
Indeed.
Okay, I know you mentioned that testicular cancer is rare, but if you can just give us a little bit of an overview about it, also what kind of symptoms men should be on the lookout for.
So the testicular cancer is, as opposed to prostate cancer, which is the disease of older gentlemen, that is disease of younger gentlemen. So we can see it, up to the age of around 30, 35. It's more common during that, kind of that age. I would say that between age, 15 to 35 or so. 15, yes. I mean, we see kids as well with testicular cancer as they grow bigger. It is rarer, but, we do see, I have gentlemen at the start of, 17, 16 with testicular cancer. And, a lot of boys, they don't really know about this. They don't go and examine themselves necessarily. They are not, cancer is not on their radar.
Not on their minds at all.
In your mind when you are, you are a teenager. But, it is important to highlight that it is, in fact, disease of those age groups. And it is very important indeed for our teenagers as well as our younger men to please examine yourself. This is at least one of the tissues in the body that it is possible to examine. It is more or less like breast cancer that, it is accessible. You can examine yourself. You can see if there is any large or, lump, or if there is any changes in the normal composition of the tissue. Certainly, a lot of cases, it is the patient that they actually detect the lesion in the testicle themselves. So it is important to highlight it. It is something that is very largely neglected by that age group. And please be aware that this is the common age group that patients, they get testicular cancer. Please examine yourself.
Thank you. Thank you for shedding light on that. I didn't know that. Even I didn't think that someone at 15 would just have to think about cancer or to sort of examine themselves. No one probably thinks about that.
Yeah, of course, you don't want to, make people frightened, but,
Yeah.
You have to be aware of it. And if it is just, it takes, just self-examination when you are in the shower or something, just look at the borders to see if there is lump or bump or anything that you're suspicious about. This is an easy thing. You don't really need to go and see a doctor. You don't need to do any particular scan or anything. It is just a self-examination.
Okay, great. Any other tips or advice you would like to share with our listeners today?
Look, cancer is there. It is a disease that we are dealing with this very commonly, especially in this industrial world. It is becoming more and more common. Unfortunately, a lot of us, whether we have personal experience or somebody in the family, they are dealing with cancer. So there is nothing really, this is not something that we should brush it under the carpet. It is just to be aware of it. That we know that it exists. It is to take it seriously. It is to think that it could also be me, not my friend or somebody else. Could also affect me. Take it seriously. Go and see your doctor. Do the screening. Do the self-examination when it is possible, and follow a healthy lifestyle. At least for those modifiable risks that you can modify, please do that.
Great. Thank you so much, Dr. Saeed, for being with us. This was very enlightening, so thank you.
Thank you. Thank you very much for having me, and stay safe.
For our next episode, we're switching gears to discuss mental health and the stigma around it. So let's all join hands into fighting the stigma together so everyone can get the support they need. As you probably know, but it wouldn't hurt to say it again, we're available on both the YouTubes, Spotify, Apple Podcasts, Anghami, and Amazon Music. Stay well and keep thriving.